Good morning, my people. I just felt the need to do this video this morning because a very good friend of mine who is outside the country, even though he's not medically inclined, he called me this morning asking me why would a doctor recommend that his father's leg be amputated, that they want to cut off the leg because of diabetes. Is it that they cannot treat it or what? Why will they cut off the leg? Why will he be amputated? He was very angry and bitter, but I had to explain to him, and that's the same thing I want to do. Let me tell you how people that have diabetes are at great risk of having amputation. In fact, look at this picture now. This is someone whose leg was amputated just a few days. The leg was cut off and it's even high up. Now let me make it clear. When someone has diabetes and is not controlled or is poorly controlled, meaning that at every point in time the blood sugar level is high, is always very high. The normal level for random is 200 milligram per dl. Then for fasting, you have below 126 milligram per dl. And now you find some people having their fasting above 200, above 300 fasting, and having their random 400, 500, and they are walking around with it and thinking that this diabetes is not getting to them, is not causing any problem. My dear, for the fact that your blood sugar level is always elevated and you don't feel sick, it does not mean that damages are not going on gradually. Now let me tell you how it damages the legs. Once the sugar level is always high, it begins to damage the nerves and the blood vessels. Now, the ones at the legs and the feet are always very prone to these damages. The kidneys as well, but today I'm talking about the legs because of the amputation. Now, when the nerves are damaged, it becomes very difficult for them to feel pain in those legs and feet. And even when they sustain a very little injury, like a small cut, or they even match a little stick in the farm, or they match on a nail, they won't even feel pain. Even if they are wearing a very tight shoe that is really injuring them in the leg, they don't feel the pain. Now, when this small injury comes in, remember the blood vessel is also damaged, meaning blood and oxygen will not be getting to that leg properly, and then there will be poor wound healing. Sometimes the wound doesn't even heal. They are not still aware that they have injury and is worsening. Now that place, the infection will set in. Bacteria, of course, they love anything that is decaying. They love everything that is bad. They will enter into the site of the injury because an intact skin, bacteria rarely enters an intact skin. But once there is an opening, it finds it very easy to enter. Remember, with this high blood sugar level, the immunity is already low. The body cannot fight this infection. Then it begins to expand in the leg. It begins to expand. It begins to climb up gradually. This is when they begin to run around. Oh, my sugar is high, I need to bring it down, but all the while, it is high. Now, a lot of people still, instead of seeking for proper medical attention, they want to first of all get to the patent medicine dealers that they will be dressing it. Sometimes they even switch into herbal medication. They'll have to take that one for some time and see that it's not effective. Then they will present very late in the hospital and they will expect doctors to do magic. We don't do magic. We have to follow it. We have to do the needful. So the best thing to save the life, especially when the infection is already overwhelming and the leg cannot be salvaged, The easiest way to salvage the whole body is to cut off the leg, to do amputation. So, my friend that is shouting on the phone this morning, why should the father's leg be amputated? You failed to remind your father that he should make sure the blood sugar does not exceed 126 in fasting and 200 in random. So he has been walking around, drinking beers, eating anyhow, not bothered about the sugar level until the damages sets in. And now, it's amputation. Really very sorry. You can really make do of what you want with this video. You can start on time to monitor your parents' blood sugar level so that it doesn't lead to amputation. You can start on time to check it, monitor what they are consuming, make sure the blood sugar level is under control. This is the only way that they can be safe from amputation, kidney injuries, and a lot of other complications of uncontrolled diabetes. Have a great morning. Share this message to those who you feel it might help. A stitch in time saves 9. Ka anyị jirikwa efifie chọwa ewu ojii. Diabetes a na-emekwe mmadụ arụ, ọ na-arụkwa mmadụ eshi. Ekwelekwe m onwe ego na. Have a nice day. Thank you.